Simla chapter, Founder Secretary of Indian Fertility Society, Himachal Pradesh chapter, North Zone Coordinator of Hello Tomorrow CMEs, Advisor of Sexual Medicine Committees, Member of Public Awareness, and many other credentials. Welcome, sir.
Thank you so much. Thank you so much for such kind words. At the outset, I like to thank the society, this International Sexual Medicine Society, for giving me this opportunity to speak. So the topic of me has been discussed since morning many times. So now I'll be again defining the same topic with some different masala. So, uh, one of the important cause of infertility and sexual dysfunction in male or female is unconsummated marriages. Marriage is not unconsummated, and that is the only reason to the marital discord also. So infertility again. So many of the patients, why the patients are coming to us? They are coming to us because they are infertile. Then after taking histories, the history proper taking, then we are getting into the diagnosis that yes, they are not still having consumed the marriage. So it means that a couple never have sexual relationship, but studies have shown that sometimes not only the intercourse, it cannot be consummated at the first try, but it could also be delayed for years and even would never happen. This is called unconsummated marriages. Different physical, mental, social, and cultural factors are effective in occurrence of this disorder, so it should be considered multidimensionally. It's not single-handed. So unconsummated marriage mainly is due to vaginismus, again discussed many times since morning, in the women, or premature ejaculation in the man. So in females it is vaginismus, and in men it is premature ejaculation. To bring to completion is consummation, or to complete a marriage with first act of sexual intercourse after the ceremony day, to fulfill a sexual desire or attraction, especially by intercourse. So, in many traditions and statutes of civil or religious law, is the first act of sexual intercourse between two people, either following their marriage to each other or after a prolonged sexual interaction. So, it is again the definition, one of the definitions. And coitus means or refer to the insertion of the penis into the vagina, probably the most common form of sexual intercourse. It is also the only kind of sexual intercourse that can lead to conception of a child. For most couples in most cultures, sex equals to intercourse. People believe that intercourse is natural and instinctive, but many societies where sexual contact between males and females was restricted to coitus. So such societies usually put a heavy emphasis on the procreative function of sex and discouraged all sexual pleasures, especially in women. It has been thought that only this emphasis is on the sex is only for procreation. So it is not meant for women. In many of the societies it has been said. Indeed, there are still some men for whom any other love play is a ridiculous nuisance. It is there. It is seen and it has been read. It has been also, like we come across these kind of patients. They always say, कि नहीं, ऐसा करना हमारे लिए पाप है. So it is again said, कि they don't do any kind of sexual plays or foreplays or any other activities, but procreation is the only thing, that is, coitus is the thing when they are procreating the thing. So this is the thing where they think. So in wedding night scripts, I found two things. Originally, it is marriage is served to integrate couples into an intricate system of community ties and obligations, and it has primarily based on economic, political functions rather than romance. Marriage regulated sex, and the wedding night fulfilled the ritual of permitting sex. So marriage is permitting them to have sex. It is said in these scripts. Yet some people, in discussing the specifics of their own wedding night, consider the ritual of sex on the wedding night as a necessary act to solidify the union of two people, while others dismissed its purely sexual significance. They insisted the night to be about intimacy and a private celebration of the marriage. Some they like to discuss, but the other They think it is their private life and their intimate moments which they don't have to discuss. These are the things which are seen. So it is again inability to consummate marriage is usually suffered by the newly wedded couples has been one of the most common sexual problems hindering conception and pregnancy. So can be defined as inability to engage in successful coitus within the marital ward. So usually the newly wedded couples are suffering from these. Maybe some anxiety, or you can say honeymoon anxiety is there. So therefore these kind of people, the newly wedded, they only for some time, just due to their anxiety. So where does the problem lie? A problem with the sexual functioning in one or both of the partners in a couple can prevent intercourse. So reasons: lack of sufficient sexual information, sexual performance anxiety, could be vaginismus, lack of privacy. Privacy, again, most of the people are from rural backgrounds. They don't have proper bedrooms, proper space to perform. So it is again lack of privacy which is causing unconsummation. History of sexual abuse in the past, or unreal fears, cultural and social factors. Strict religious rules, sexual limitations applied by the family and the society, also specific customs about the first sexual intercourse. The virginity, again it is said that it has to be meant for the husband only. So these are in some of the societies. Premature ejaculation and erectile dysfunction in men. As I told you, honeymoon impotence. It is again an anxiety where a newly wedded couple or the male is unable to perform. It is nothing but just due to anxiety. But this is a devastating condition with a grave consequence for the couples and the families. That is why we are here discussing to make the couples happy. Dr. Sita is not everywhere. So you have to be yourself as Dr. Sita to create happiness in the families. Male, female and combined factors were found to be responsible for non-consummation. In male factors, we have got erectile dysfunction, which was found to be the top ranking causing, accounting for 79.37%, followed by premature ejaculation, lack of sexual desire, homosexual orientation, sexual aversion disorders, disorders of sexual preference. So these were the enlisted factors which were taken in the form of male factors. In female factors, we have got vaginismus. It is the commonest and it has been discussed till morning many times in many forms. So sexual aversion disorders, sexual desire disorders and lesbian orientation. Couple factors, they both can have a same, these factors like male and female, they can coexist also. So why unable to consummate? They may be ignorant and inhibited about sexuality, or sometimes either of them might have bad experience of coitus with another mate but unable to performance with the index partner. बहुत बार देखा गया है कि एक पार्टनर से नहीं हो पाता, लेकिन वही मर्द दूसरे पार्टनर के साथ वो इजीली कर पाता है. So this is again one of the very commonest thing which is again asked by us also. क्या आप अपनी बीवी से कर पाते हैं या क्या आप बाहर जाते हैं तो कर पाते हैं? So it has been many times it has also seen. Usually in our culture, husband and wife may not have any experience in penetrative intercourse before marriage. It has been seen. As I told, virginity is for the husband also. So for only. So it has been seen like the intercourse is firstly has been in their first night only. So anxiety resulting from repeated attempts at intercourse contributes to the sexual dysfunction. बार बार न कर पाने से भी बढ़ जाता है. It is anxiety has been added. Vicious cycle बढ़ता रहता कि नहीं अभी भी नहीं हो पा रहा, अभी भी नहीं हो पा रहा, लगता है नहीं हो पाएगा और ये खत्म, और इसीलिए marital discord हो जाएगा. So one or the both partners may be anxious that penetration will be painful, that there will be bleeding, or that women will get pregnant. Pregnancy ka dar, STDs ka dar. So this is again enhancing the anxiety for the male. While a certain amount of anxiety surrounding sexual activity is normal, When one or both partners are overly anxious, sexual function can be affected in following ways. How? The male partner may have difficulty maintaining an erection. He cannot maintain the erection strong enough to allow the penetration, or he may lose his erection just prior to intercourse. So anxiety may contribute to premature ejaculation also just prior to reaching to the penetration. So this is how the male is behaving in his anxious state during the act. The female in anxiety may prevent the woman from relaxing enough to allow penetration. She may close her legs or contract her vaginal muscles. This presentation is referred to as vaginismus, defined as the persistent or recurrent difficulty of a woman to allow vaginal entry of a penis, a finger, or any object despite her expressed wish to do so. May indeed be a factor contributing to the perpetuating many sexual problems. There are many components to sexual problems, including physiological ones, but there may be a physical problem also. Therefore, each partner in a couple presenting with unconsummated marriage should undergo a physical examination. It is not done that only a history is taken, but you have to examine not only female but also male to check the anatomical factors, whether there is any physical factor which is hindering the penetrating of penis to the vagina. Physical presentation of the female partner could be like sexual pain disorders such as localized vulvodynia, also known as vulvar vestibulitis syndrome. A common condition is characterized by pain with touch at the entry to the vagina, which can prevent intercourse. Or hymen may be a barrier to the intercourse. Some women have a very thick hymen or a septate hymen, which is a thin piece or membrane running vertically which separates the vagina into two. So hymen could be a barrier. While most of these conditions can be addressed with counseling and physical therapy, including use of vaginal dilators, in most cases a septate hymen needs a surgical correction. Lack of anatomical knowledge. मेरे पास एक कपल आया, वो रूरल कपल था, again very young couple, but he used to perform on the umbilicus of the female and having satisfaction. So the couple came to me just for the complaints of infertility. He was unable to consume the marriage and both were happy. Rural couple and very happy. बस बच्चा नहीं हो रहा जी. कहाँ perform करें? Umbilicus पे. So this is how you have to be make them aware. So frequently lack of knowledge about sexual anatomy and physiology may contribute to a situation whereby attempting intercourse feels awkward and unnatural. Again, डॉक्टर जी किसने देखी है? Again, उसमें भी उसकी तरफ से भी मतलब वो चीजें हमने फील की हुई हैं. As a male gynecologist, मेरे पास भी एक पेशेंट आई, again infertility, 3 साल की इनफर्टिलिटी, बच्चा नहीं हो रहा, दिन धीरे से अपनी मदर के साथ आकर मुझे बोलती है कि सर ये ना पीछे से आते हैं. So this is again, it happens when there is no knowledge, but again you have to tell them कि no, there is again you have to penetrate the other way to get her pregnant. So often all that is needed is some basic anatomical information and positioning advice. Sexual positions, again it is very common nowadays, anytime, every time available on net. Statins give men better erections. Scientific fine cholesterol busting drugs can help combat erectile dysfunction, it has been said. Now comes the blue pill, नीली गोली, very popular, anytime, every time, even पान वाले के पास की आपको ये नीली गोली मिल सकती है. उसको नहीं पता कि वो 50 मिलीग्राम की दे रहा है, उसको नहीं पता कि वो 100 मिलीग्राम की दे रहा है, लेकिन वो दे रहा है क्योंकि उसको पता है कि ग्राहक मेरे पास आएगा, एक पान की बेड़ा खाएगा और एक गोली मांगेगा कि शाम को मुझे रहना है, मुझे एक गोली चाहिए. So again, this is also there, but again you have to be very careful to make them aware that what are the side effects of this sildenafil, which is popularly known as neeli goli in the masses. Foreplay, very important. A couple may report that women's vagina feels dry and excess friction prevents intercourse. In this case, the couple may be advised to ensure that the intercourse takes place when the woman is sufficiently aroused, and here comes the importance of that foreplay. Positioning, as I told, while some people are physically active, very aware of their bodies and comfortable with movement, other people are less, so may simply have not figured out how their bodies move in order to comfortably find a position for intercourse. One or both of the partners may have mobility problem or difficulty getting into or maintaining a position. So a woman may have difficulty keeping her legs open, or man may not be able to hold his weight upon his arms. So you have to counsel them that which is the comfortable position for both of you, so that you can enjoy or consume the marriage. In these cases, as well, consultation with a physical therapist may be helpful in providing exercising and positioning advice. Effects. What are the effects to the family, to the society? First, it is a severe marital distress. The family of that couple is never happy. कलेश, रात दिन का कलेश है, सास के साथ, ससुर के साथ, कैसे भी करके कलेश है. So this is, again, you have to consummate the marriage to make that happiness in the family. So happiness by consummation of the marriage. Frustration, depression and anxiety for the couple. Gradually it leads to adjustment problems and hostility between the couple, and may even end up in divorce. So we as a sexual health specialist have to make these couple happy in the form of consummation of marriage. Talking. Very important. You have to talk. Again, what Dr. Sita is doing? Dr. Sita is talking to them. Dr. Sita is making comfortable to them, making different kind of hypnosis, exercises, yoga, beach therapy, water therapy. So many therapies are there by talking to them. So she is talking to them. So doctors or parents, they need to talk to their couple non-judgmental way. There should not be any judgment prior. Understanding the approach, start with general inquiries, acknowledge the difficulty in talk. Encourage the person to talk about sex. So much taboo. Sex बोलते ही आंखें नीची हो जाती हैं. एक बार बोलकर देखो, sex सारी आंखें ऐसे होती हैं, क्या बोल रहा है? So it is like that. So you have to break the taboo. No assumptions. Myths. Sex is not only intercourse. It could be anything. So man should be sexual leader? No. Female could be a sexual leader also. Women should not initiate sex. It is not like that. She can always say, मुझे भी चाहिए. ठीक है? Then respectable people should not enjoy sex too much, but should not masturbate. Not like that. Okay? So पहला हमारे जो forensic के जो हमारे professors आते हैं वो यही बोलते थे कि 99% लोग masturbate करते हैं और जो 1% बोलते हैं नहीं करते वो झूठ बोलते हैं. So it is not like that. If sex is not good, something is wrong with the relationship. So myths on the day of marriage, first night and marital life. What? Sex with virgins increase the sex power. Nothing like that. Once homosexual, always homosexual? No. Suhag Raat should be read. Very common. Very commonly said, आपके दुल्हन के हाथ में एक छोटी सी लाल की सिंदूर की शीशी दे दी जाती है. लाल रंग कि कुछ भी हो, जैसा भी हो, तूने बिस्तर पे फेंक देनी है. उड़ेल देनी है कि नहीं, सबको विश्वास हो जाए कि नहीं, marriage has been consumed. Nothing like that. No approved aphrodisiac. Size does matter. Nothing like that. No sex in pregnancy or menses. Nothing like that. So it is again, these are the myths which should be again broken by us and by talking to the couple and to the patients coming to you. Common triggers: psychological, relationship problems, life stress, anxiety, depression, fear of pregnancies and STDs, lack of knowledge of sex, negative sexual history. These are all again I have talked about. Environmental, physical, partner problems. These are again talked. Rural or poverty is one of the thing. Like in environmental space, many children, physical discomfort. In physical, we have got pain, illness, drugs, alcohol, or many childbirth. Partner problems, non-responsive partner. उसको मतलब ही नहीं है कुछ भी, वो पीट करके सो जाएगा. So he is non-responsive, whatever. या तो वो सो जाएगा, या वो बोलेगी मेरे सिर में दर्द है. So again इन चीजों को हमें दूर करना है. मैं सारा दिन थक चुकी हूँ, अब तुम जाओ. 2 बच्चे हो चुके हैं, नहीं चाहिए. Whatever. So preferences problems, preference. ठीक है, अब उसको ठीक है, कुछ और चाहिए. So could be there. Disinterest. इच्छा ही नहीं है. So defining sexual dysfunctions: inability to participate in activity, sexual dysfunction in all occasions, duration of 6 months, significant stress or interpersonal difficulties, no history of drug use, physical disorder, mental disorder, etc. What are the stages? We have got different stages. We all know excitement, desire, excitement, orgasm, and resolution. So this is the sexual cycle which we all know. In investigations now, how to investigate the couple. Local examination is a must. Investigate for sugars, blood pressure, general physical examination, and basic investigation for the couple should be done. In the treatment, as I said, it is a multidimensional problem, should be treated multidimensionally. So many of the therapists should be involved in the couple. Dr. Sita, so beautiful management of couple or unconsummation of marriage. So narrative exposure therapy, you have to narrate how you have to expose, educating the anatomy of female and male reproductive organs, corrective misconceptions, all myths should be busted. Educational foreplay, there should be, again, they should be told the महानता बतानी है foreplay की foreplay का मतलब क्या है. It is not only entering the penis into the vagina, but the foreplay, how you have to do, what you have to do, and what is the benefit of the foreplay. Educating body, exploring and non-sexual and sexual massage and penetrating the vagina, first by the women finger and then by men's after relaxation. Dual sex therapy. Establish communications in marital unit. Misconceptions should be dealt properly and should be heard, and it should not be judgmental. Nobody should laugh, nobody should talk. It should be proper. So when you are talking to the patient. Imagery, in which foreplay as an enjoyable alternative to intercourse. Then sensate focus exercises. Stage 1, partners to touch each other. Stage 2, partners touch each other genitals. Mutual touching, then women on top. Kegel's exercises. Whenever it's being a gynecologist, I have to explain this exercise to my patients who are having or going to be having prolapse and all. So what are Kegel? You have to explain there and then with putting your 2 fingers in the vagina and explaining how you have to contract your muscles. It is not only telling them कि ठीक है, लैट्रिन रोक लेना, पेशाब रोक लेना, थोड़ी देर रोकना, 1 2 3 गिनना हो जाएगा, दिन में 10 बार सुबह, 10 बार दिन, 10 नहीं. You have to explain them how they have to contract their muscles. So putting your 2 fingers in the vagina and asking her to contract, then she can understand how she has to contract in Kegel's exercise. Breathe normally, quickly contract and relax. Contract muscles, count 3, relax. Inhale, slow, contract 3, hold 3, relax 3, muscle relax, beard down. This is how you have to explain with keeping your fingers in the vagina. Vaginismus, vaginal dilators with fingers and dilators, again, many of them has taught you. Anti-anxiety, antidepressant, sometimes they are used in the form of so many drugs. Hormone therapy, testosterone is meant, so sex drive in both male and female are seen, and hormone replacement, HRT, is also be used. Water-based lubricants is very important. Saliva sometimes, antibiotics off and on if she is having or he is having some problem or STDs or any discharge. Treatment depends upon the nature of each couple's problem. So it should, what is the cause, you should know first, then only treat the patient. So medicines, whether he or she needs medicine or sexual therapy or any operation or surgical intervention or a combined of any of these methods. So unconsummated marriage is a condition in which 100% cure or recovery can be assured if the couple is willing to undergo the treatment. As we have seen with Dr. Sita's batch therapy, she has told us that yes, it is 100% curable if they are willing. So general practitioner, yes, they have got a role because patients generally visit their family doctor with the problem and then he or she can refer to us. Psychiatrists, yes, a very big role in making their anxiety relieved. Role of a gynecologist, again, yes. Role of alternative medicines. We have got so many nutraceuticals now there, but Ayush or some homeotherapy, I have not tried, but that some people, they say some Ayurveda or homeopathy they have got, but no roadside selling or powerful. They are doing nothing. I have asked them, I have met them. They are just giving Viagra by piecing them. They are just piecing the Viagra, making pudia of them and distributing to their male patients ki jao aaj ki raat ऐश करो. So they are doing nothing but just giving Viagra. Role of hypnosis, yes, there is. Role of religious priests to drive away the evil spirits, no, there is no role. So it is not like that कि आप मंदिरों में ले जाओ जी ये तो मानी बन रही है और ये ऐसे से परफॉर्म नहीं कर पाती है जो भी है, but there is no role of all these religious spirits or witchcrafts. Narco-analysis, I have not seen, but yes, some of the studies they show that they have got. Some say role of sex under anesthesia is there. Role of counselors, it's a big role of counseling. As I told you, you have to talk to the patient, then only she or he can relieved by this thing. So it has got a big role in counseling this thing. Child sex education, very important. You have to teach them at their appropriate age group that at this age you have to tell, at this age what you have to tell, at this age what you have to tell. Again, you have to decide yourself. So in the new terminology, instead of unconsummated marriages, the term unconsummated relationship has been used. It could be useful to describe all over the world a relation where sexual intercourse never succeeded after a 6-month period of attempts, and where a social pressure is not relevant and privacy is guaranteed. In cultural systems where marriage is mandatory to have sex, it is obvious that relationship means marriage. First attempts dysfunction could be a useful term to describe the impossibility to perform an intercourse because of social cultural pressure to have an erection and then an intercourse as soon as possible, with the aim to be integrated in the society. In cultural systems where marriage is mandatory to have sex, it is obvious that first attempts means honeymoon and bride's defloration. No. Thank you so much.
Thank you, sir, for a detailed explanation on a complex topic. Questions? Two questions from.
Thank you so much.
Thank you, sir.
Please be there at the stage, sir. Please be there. Thank you so much for such an elaborate presentation on unconsummated marriage, which are we are discussing this right from the morning, different aspects of abnormalities, and he has elaborated more on that. And thank you so much. Let us felicitate him. I request our chairperson to felicitate Dr. Alok Sharma. Thank you.